Richmond resident, a proud Contra Costa resident, I am really proud. I guess I see why you didn't use the mic. I'm really proud to stand with all of you because you get it. You understand how important this issue is. You understand that this affects everybody. In fact, you know, good research says when everyone has health insurance and everyone gets health coverage, we are all healthier. That is an argument we should use to people who may be on the other side of the political fence from us, who say, why should I be paying for health care for lower income people? Because your health is better when others have health insurance and health coverage as well. Yeah. Second, to tell those folks on the other side of the political fence, when we all have preventative health care available, health care costs for everyone in the system are less. It doesn't take a rocket scientist to figure that out, that when you have access to a primary care physician and you go in and you get your preventative health care, you may not need to go to the emergency room where it's going to cost more money. Good research and good studies show it is less expensive to the taxpayer long term to have people covered with health care. Right? Knowing that in the Contra Costa, we've had our own advocates, and they came up with a great slogan, and I'm wearing it, and I want you to say it. Right? On three, we're going to say health care for all, right? Yay! 1, 2, 3. Health care for all! One more time, right? 1, 2, 3. Health care for all! Because, you know, here in Contra Costa, we have a health plan, and Congressman DeSonia talked about that, and I know when he was on the board of supervisors, he was a strong advocate for it as well. That, in fact, our health plan at Contra Costa was the first public health plan in the United States that got qualified for Medicare reimbursement. That was way back in the late 1970s. And so when the Affordable Care Act passed, the enrollment in the Contra Costa health plan went from 100,000, mind you, there are about a little over 1 million people in Contra Costa. So it went from 100,000 to 200,000. So think about that. Are we going to want to cut off over 100,000 people, or potentially more, from health care in this county? Right? So about nearly 20% of folks who live in Contra Costa get health care through the Contra Costa health plan. And you know, we have 1 hospital, 11 clinics, 2 of which are in West County. People will not be able to go into those clinics to get health care. It affects real lives, right? I want to ask those of you, because we've had a great coalition of folks here in Contra Costa who have fought for health care. I want, raise your hand or step forward for those who've been fighting already on this issue locally. There's a number of you I see here. So it shows you how people feel here. We just have to make sure that we spread this word of why it is important to have health care for all, right? Yeah. That's what this is about. Yeah. It's about health care for everybody, regardless also of your immigration status. Right? In fact, we started a program working really with advocates to start enrolling adults who, regardless of immigration status, into a primary care system with our community-based clinics. That also. In fact, we want to expand that to cover up to 30,000 who are here undocumented in the county or don't have health care. That will be at risk as well. That will be at risk as well. So the message as we leave, and some of you I know are going over to San Francisco, is to connect us and say, public health is better when we all get health care. It costs less money in the long run when we all get health care. It is the right thing to do from a moral standpoint. It is a right. And I know that Richmond, Contra Costa, the East Bay, California, and this country are going to stand up for that. And I really appreciate everybody who stepped forward and talked about their personal story.